Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental. Wanted to do a little quick video on cracks and fractures in teeth and how we handle them differently here at Moonlight Beach Dental. So there's something called the Poisson effect, which is actually the way cracks propagate under old fillings, like the old silver, amalgam, mercury fillings. And I'm very, very well studied on how we can safely remove the mercury and also not further propagate the cracks downward inside of the tooth. This involves a lot of special techniques. So over time, when we have a large filling, like a mercury filling, or a failing composite resin filling, the enamel will flex around the weak areas of the filling if it's not bonded well, or if it's a silver filling that's not bonded at all. And over time, that'll introduce a lot of cracks and fractures. We can also crack our teeth when clenching or grinding, or if we have issues like sleep apnea, we can end up cracking all of our molars when we slam our teeth together in order to open our airway. So there's a lot of things that can cause cracks and fractures. And the way I like to treat them is by dissecting the crack in the most conservative way possible. Now, one, that's catching it sooner rather than later, so that if we can manage it with just a filling, let's manage it with just a filling and hopefully get another 5, 10, 15 years out of the tooth. If a crack propagates too far in towards the nerve or too far down the root, then we're risking things like a nerve damage where we're going to have to do either an extraction or a root canal. And those are two things, if I can ever possible help someone avoid, I would like to avoid. And if a tooth needs more treatment, like something like a crown that's going to go all the way around the tooth, what that's going to do, ideally in the most conservative way, is hold the two parts of the fracture together with something like a crown that goes all the way around the tooth, so that it's essentially acting like a cast to hold the crack together. Now, while the crack won't heal like a bone fracture would, we can, if we sustain it in the right way, prevent it from leading to something where we cannot restore the tooth or save the tooth. So those are a couple things I'm really passionate about in terms of trying to get your tooth the best long-term result possible, but also to help you avoid tooth loss or anything painful. And that's how we do things differently here at Moonlight Beach Dental.